Hello, folks. Welcome to Community Health Choices, or CHC presentation, Part 2 for the PA SMP volunteers and any other interested parties. If for some reason you're just coming across this presentation and need a copy of the slides, you can contact either Kathy or David, whose contact information is on your screen now. And for those that did go through our first PA SMP webinar, I want to apologize for our technical difficulties. And as promised, we're re-recording the webinar without the chipmunks and gremlins. So hopefully you will be able to hear the presentation much better this time round. But as always, you can always contact myself, Kathy Cubitt, or David Johnson, who will be speaking later in the presentation at any time at Carrie. You can call or email us. This slide we include in all of our presentation slide decks because our world is full of acronyms. So you may come to a slide later on and need to know what a particular acronym is, and you can go back to this slide to reference to be sure you know what it is we're referencing. Okay, CHC Overview, or Community Health Choices. This is Pennsylvania's new mandatory managed care program that transitions how our long-term services and support system is paid for and delivered, moving from a fee-for-service system to a managed care system. This includes all adults age 21 and older who have both Medicare and Medicaid, whether or not they need long-term services and supports, and those that only have Medicaid who need long-term services and supports. And we will get into more detail about these populations shortly. So under this new system, the managed care organizations, or MCOs, are the ones that are administering the long-term services and support system. And there are three plans consumers can choose from. One is called AmeriHealth Caritas Community Health Choices, or in the Southeast Pennsylvania area, it goes by Keystone First Community Health Choices. The second plan is Pennsylvania Health and Wellness, and nationally this plan is known as Centene. And finally, UPMC Community Health Choices. We'd like to mention that Community Health Choices is not the same thing as Health Choices, which is Pennsylvania's long established, for decades now, Medicaid managed care program for physical health care, but it does incorporate a lot of the same benefits. And we also like to mention that the LIFE program, while not technically part of Community Health Choices, it is an alternative for some that are age 55 and older. So the next few slides, we're moving into Phase 3 of the rollout. And so we'd like to give a sense, these slides are from the state, and they show the total population and a breakdown. And we're going to show you the Phase 3 zone, which will start in the other parts of the state right now. It started in Southwest Pennsylvania on January 1st, 2018, and in Southeast Pennsylvania this January 2019, and then the rest of the state January 1st, 2020. So these slides give you a breakdown of now the zones that are going to be, they're starting to get materials, and they'll be moving into Community Health Choices in January. So you can look at these numbers at your leisure. So again, we talked about this earlier about who's included, And so it's really two groups of folks, and some, again, are those that have Medicare and Medicaid. So instead of having the state or the access card pay for the Medicare co-pays and deductibles, that it's now going to be the plans that assume that role. And for those that are getting any kind of Medicaid-funded long-term services and support, whether in a nursing facility or in their homes, this is where the major changes are occurring. And again, we're going to get into detail about that later in the presentation. So residents in state veterans homes and those, you're familiar with the term partial duals, that get some cost sharing through the state, they are not included. So again, the rollout, we started, as mentioned earlier, in the Southwest in January. In Phase 2, we're in Southeast, the 5 counties listed there, and now the rest of the state will be happening soon. And for the final phase, a couple of key dates on this slide. November 13th is the last day before someone will be assigned to one of those 3 plans if they don't make a choice. And they're getting mailings and materials starting now, and or I should say in September. And December 20th is the last day that they can change their plan. If they're assigned to a plan that they didn't want, they can have up to December 20th to make a plan change to have that in effect on January 1. So again, this slide shows some of the communications that participants are currently getting in again, that vast middle region and top part of the state. And the consumers that are getting services in their homes, their service coordinators are being trained and will be reaching out to each of their consumers to talk about community health choices and what the person needs to do. And nursing facilities are talking to their residents that are going to be impacted about these changes. And all this is happening now. The benefits. So the benefit package, all the physical health for those that are getting their only have Medicaid, that's going to be the same as what they're getting under Health Choices now in the state plan. And behavioral health is offered through the Behavioral Health Choices program, and this is a new benefit for older adults in the aging waiver and for people in nursing homes. And again, we'll talk shortly about that. Pharmacy, again, is the same as what's in the state plan, and for those that have Medicare Part D, that coverage will not change, and we'll be talking more about the Medicare, how this community health choices works with Medicare soon. Long-term services and supports. So it includes all the services, waivers that the Office of Long-Term Living offers now, and nursing facility care. And if consumers are directing their own services, such as through Services My Way, those options still continue. And transportation, which is a big service need, all consumers continue to get emergency and non-emergency medical transportation. And those that are getting waiver services can also get non-medical transportation as outlined in their service plan. The behavioral health choices, this is a new benefit again for aging waiver and those in nursing facilities. Unfortunately, people haven't been taking advantage of this benefit, so we're hoping to get more people aware that this is available. And there is only one behavioral health managed care organization by county, which this link on this slide will take you to that information. The independent enrollment broker, some of you may have heard of Maximus, and right now they have contract to provide this service, and they work under Community Health Choices not only to help with the eligibility and enrollment, but also to provide counseling to consumers about what their benefits under Community Health Choices and what some of the different plans may offer that may be more beneficial to them. Each plan offers what they call a value-added benefit that may be of interest to different participants. So they are helping consumers that are transitioning now, and then people new to the system. They're educating them about their plan selection and helping them get enrolled into any particular plans. So consumers can call the enrollment broker to check what plan they have if they're not sure. They can check provider networks, get help with changing plans, and if they are in need of long-term services and supports, there is another level of an application process that needs to be completed, and they would help with that. And we always encourage consumers to use a prize for any Medicare counseling or any kind of Medicare plan changes or enrollment assistance. And you can also call CARI, as we are in a prize site. So under Community Health Choices enrollment, the one real positive part of Pennsylvania's program, and this is a key point, a takeaway of our webinar, is that consumers can change their plan at any time. Now, it can take up to 6 weeks for that plan change to go into effect, but it is important for consumers to realize they have and can exercise this option. And again, if a consumer is new to applying and they don't make their plan selection, they will be auto-assigned into a plan because this is a mandatory program. And this slide gives you the different enrollment contact information. And again, you can always call CARI if you have any questions or you're having any problems related to enrollment. And the last thing of note is that, as stated here, there's no actual changes in enrollment eligibility. So the same financial and clinical eligibility criteria applies. So now we're going to move on. With continuity of care, I just want to quickly mention for those that are in, again, the Phase 3 part of the rollout, they will not have any changes to their providers or care plans for 6 months or 180-day period. But again, the provider has to be willing to continue to work or provide services during this time. After the 180-day period, and we're in that phase now for the Southeast and Southwest Pennsylvania, the consumers have to use the network providers that are for the long-term services and support side of things, with the exception of nursing home residents who transitioned to Community Health Choices when it started in their area. Those folks are grandfathered in and can't be forced to leave their facility unless that's something they want to do, if they want to move to another facility or move to the community. So they have that. The continuity of care period for physical health services is always 60 days, and now for consumers in Southwest and Southeast Pennsylvania that were beyond that initial 6 months continuity of care period, that is also 60 days. So, for example, if someone changes their plan, they can be assured of continuity of care for 60 days. So now we're going to move on to more of Medicare issues, and I'm going to turn it over now to David Johnson, Carrie's CHC advocate.
Hello, everyone. As Kathy had mentioned, community health choices is a massive transition for consumers and providers. A large percentage of consumers transitioning into community health choices are duly eligible for Medicare and Medicaid. Whether those individuals are eligible for long-term services and supports through Medicaid or not, there are important considerations and certainly some key advocacy tips to keep in mind with regard to a consumer's Medicare coverage. First and foremost, and most importantly, an individual's Medicare coverage and access to Medicare providers will not change because of community health choices. Now, if someone's in a Medicare Advantage plan that has either left the area or has changed their provider networks, that might have some adjustments to an individual's Medicare coverage and access to providers. But generally speaking, Medicare coverage and access to providers will not be impacted by community health choices. It will not change Medicare benefits or services, and consumers can keep their primary care physician even if that PCP is not in a consumer's CHC managed care organization network. Rules and guidance suggest that even if a Medicare provider is not enrolled in the state Medicaid program, there are CHC rules that will allow them to order, refer, and prescribe. So consumers should not be changing their PCP because of CHC. More importantly, consumers can use Medicare providers even if that provider is not in the CHC MCO network or has a contract with those CHC plans. And we'll discuss Medicare cost sharing momentarily. For consumers who are Medicaid only or are seeking out services that are not covered by Medicare, they will have to use their MCO's provider network, again, for those services not covered by Medicare but covered by Community Health Choices. An individual's Community Health Choices MCO should be coordinating their Medicare services and providers. The idea is to have as integrated care as possible. There is a Medicare option available through each of the CHC MCO's companion dual special needs plan. We'll just discuss more momentarily. Medicare prescription drug coverage will not change because of CHC, and an individual will still get their prescription drugs through their Medicare plan. The Medicaid pharmacy benefit that supplements Medicare coverage will be provided by the CHC MCO that a consumer chooses. And participants continue to pay copays, not the CHC MCO. But for those who do not pay copays now, such as nursing home residents, they will not pay in Community Health Choices as well. Medicare will continue to be the primary payer for dually eligible individuals. They will still pay first for health care. This is not a change. The CHC plan will pay for Medicare wraparound coverage for Medicare-covered services. So this will no longer be paid by the state directly. It will instead be paid by the CHC MCO that the consumer is enrolled in. So consumers should be showing their CHC MCO card and not their access card. As we mentioned previously, an individual can go to a Medicare provider, and that provider does not need to be in the CHC MCO network for Medicare cost sharing. Providers will be having contracts with the different MCOs, and this will be for their Medicaid-only patients. But regardless of which CHC MCO a consumer has, they can go for a Medicare-covered service and have cost sharing paid for by the CHC MCO. If required, consumers will still pay small copays for Part D prescriptions. And significantly, what has not changed is that CHC MCOs and CHC providers may not balance bill participants for Medicare deductibles or coinsurance. As it relates to advocacy tips, the guidance that was issued surrounding Medicare cost sharing was met with some hiccups. And we can discuss some of the common issues that we have heard here at CARI and from other advocates and, of course, consumers regarding some misunderstandings for dual eligibles and CHC MCO's responsibility for cost sharing. First and foremost, because there are 3 CHC plans, it's important to recognize that a lot of the issues surrounding implementation and following this guidance simply can reflects the confusing nature of knowing which insurance covers what, and even the insurance plan names. In Philadelphia, Keystone products are very popular, whether they're Medicare Advantage plans. They have a Health Choices plan, Keystone First, and of course now the new Community Health Choices plan, Keystone First CHC. Many consumers would go to their Medicare providers and ask whether their plan was in network, saying, do you accept, for example, Keystone First? If the person at the front desk responded saying, no, we don't have a contract, or yes, we do, they could have been referring to any number of products, whether a Medicare Advantage plan or a Health Choices plan, and of course a CHC plan as well. We know many consumers were receiving confusing information or misinformation, and it was largely related to just lack of clarity as to which product was being referred to. So we do recommend, as an advocacy tip, consumers should be bringing their Medicare card, their CHC MCO card, as well as their access card to all of their Medicare appointments to ensure that there's no issues with understanding what insurance coverage an individual has. Similarly, when Medicare providers are billing for cost sharing, it's important to know that the CHC plan is being billed and not some other plan. One case in particular that Carrie came across as a consumer was left with a bill after a covered Medicare service. They were being asked to pay for cost sharing. They said that their UPMC secondary coverage was not in network and could not be billed. The consumer tried to advocate themselves. It was not successful. They reached out to Carrie for help. We found out with the consumer that the plan that was billed was a UPMC Health Choices plan for physical health Medicaid coverage. The CHC plan was not billed, and so this small difference in nomenclature fortunately was able to be identified, and the problem was able to be resolved. But as we continue to move forward with CHC implementation across the state, it's important to stay vigilant for consumers and advocates to make sure that the proper plans are being billed and that there's clarity surrounding how these plans are mentioned inside doctors' offices. It is a requirement that all of the CHC MCOs offer a companion dual special needs plan. It is important to note that participants are not required to enroll in a DSNP in general or the DSNP offered by their CHC plan. An individual could have Keystone's dual special needs plan, but enroll in UPMC for community health choices. There are 3 CHC plans a consumer can choose from. In southeastern Pennsylvania, there's Keystone First CHC, and throughout the rest of the state, it's AmeriHealth Caritas. And across the state, an individual can enroll in Pennsylvania Health and Wellness or UPMC CHC. The DSNP offered by AmeriHealth and Keystone, there are 2 depending on a consumer's geography. There's AmeriHealth Caritas VIP Care, or in southeastern Pennsylvania, you have Keystone First VIP Choice. The Pennsylvania Health and Wellness Dual SNP is Allwell Dual Medicare, and UPMC's offering is UPMC for Life Dual. It's important to recognize as an advocacy tip that there have been changes to Medicare special enrollment periods starting in 2019 that has limited when an individual is able to change their Medicare Advantage plan. This includes DSNPs as well. Individuals are now limited to 1 change per calendar quarter, except the final quarter, which we have annual open enrollment period. As we had mentioned, the Community Health Choices MCOs will be covering Medicare copays, but not Part D. Consumers will no longer be using their access card for healthcare copays. The CHC plan is responsible. As we had mentioned as an advocacy tip, consumers should still be bringing their CHC card and access cards to their Medicare provider appointments, just to ensure that there's no confusion, and inappropriate billing. Participants who only have Medicaid should be comparing plan drug formularies and network providers. They will be subjected to these provider networks of their CHC plans and will be needing to use providers and drugs on the formularies of these CHC plans. The CHC plan that a consumer enrolls in will coordinate with MATP, but that will be something that is coordinated by the CHC MCO and not paid for. A consumer will still need their access card for this, in addition to things like SNAP benefits. When consumers in nursing homes spend down or become Medicaid eligible, they will then transition into a CHC MCO plan and have their choice of CHC MCO plan. And of course, will still retain discharge rights. In April 2016, CMS issued new Medicaid managed care regulations that now include MLTSS, or Managed Long-Term Services and Supports provisions. CHC is an MLTSS program. These regulations include complying with person-centered planning and home and community-based settings regulations, stakeholder advisory groups, and creating a beneficiary support system. An ongoing evaluation is being conducted by the University of Pittsburgh Health Policy Institute to evaluate many key performance indicators under community health choices, and performance measures are also collected and reviewed by DHS as well. Certainly from an advocate's perspective and consumers as well, it's important to highlight the rights consumers have under community health choices, and this specifically is focusing on complaints and grievances. Consumers can complain about any problem under community health choices and can begin the complaint process with their CHC MCO. Each of the MCOs will have complaint and grievance processes, and a new grievance process is being used for CHC. Consumers still have the right to appeal any termination, denial, or reductions in services. And it's important that if an individual is getting a termination, denial, reduction in services, they'll be getting written notification of this. It's important to follow the information on these notices so that services may continue. And as always, consumers are likely to have better outcomes with legal assistance, and on these notices, free legal aid information is printed on them. So we encourage consumers who are receiving these notices and would like to appeal these decisions to contact legal aid for help. There are numerous opportunities for stakeholder engagement under community health choices. Each month there is a CHC Advisory Committee or MLTSS subcommittee of the Medical Assistance Advisory Committee that holds monthly meetings that the public can attend in person in Harrisburg or participate by webinar. For more information, you can follow this top link. An additional opportunity to learn more about CHC are regular webinar offerings by the Office of Long-Term Living through the third Thursday webinars. It's each month on the third Thursday that provides general updates surrounding CHC, and questions from the public will be answered and addressed. There is a listserv available through DHS. A link is on this slide. Sign up to get more information about the MLTSS subcommittee and additional CHC information. OLTL also maintains a CHC mailbox. The email address is listed on this slide. Stakeholders can use this as an avenue to ask questions or make comments about CHC. And lastly, particularly for consumers, their caregivers, and some providers, there's an opportunity to join a Participant Advisory Committee, or PAC. Each CHC MCO is required to have a PAC in each zone on which they operate across the state. This is an opportunity for constituents and providers to share their feedback and have that hopefully incorporated into plan governance. Carrie has prepared some helpful resources, including an advocacy journal, a general PAC fact sheet, and information about each of the 3 MCOs PACs, which is available on our Carrie website. Here's the contact information for the different MCOs. You'll notice that there's one bullet point for 2 plans, AmeriHealth Caritas Community Health Choices and Keystone First CHC. Again, Keystone First CHC is the AmeriHealth plan only in the Southeast Zone. For additional information, first and foremost, we recommend that you can give us a call or email here at CARI. Myself and Kathy Cubitt will be glad to answer any questions you have, so feel free to give us a call by phone, visit our website, or send us an email. If you come across any consumers that have questions about CHC, you're encouraged to share our information as well. We do have a dedicated CHC webpage on our website that includes general fact sheets about CHC, specific fact sheets on topics such as those living in nursing homes, participant advisory committees. We have a more extensive and exhaustive advocates guide that is in the process of being updated on our website, as well as some of our other media, such as short animated videos on key topics and some other videos. DHS does have a CHC consumer website as well as provider website. And for information about plan enrollments and provider networks, individuals can go to the IEB website, enrollchc.com, or contact the IEB by phone. Consumers can also contact the OLTL participant hotline, and of course for those Medicare-related issues, they can continue to contact their local apprise site or reach out to CARI. And for those interested in seeing which of the behavioral health managed care organization that serves their county, they can visit the link at the bottom of this slide. As we had mentioned, there's a wealth of information surrounding CHC. There are many stakeholders involved, and for those who are receiving long-term services and supports and are also enrolled in Medicare, this is a dramatic shift. The Advocates Guide on our website is a more exhaustive resource that expands on a lot of the topics we have covered in this webinar. That link is available for anyone to use and reference as needed. If you would like to stay up to date on the latest CHC information and updates and advocacy tips, we encourage you to sign up for our CHC grapevine. This is a newsletter that is sent out approximately about once per month and is curating all important updates surrounding CHC for advocates to use and to learn from. If you'd like to sign up for this newsletter or our grapevine, a link can be found on our dedicated CHC webpage. We thank you for taking the time to learn this information around community health choices, and we would love to hear from you. If you do have questions or comments or concerns, or you're hearing of CHC-related issues in the community, we encourage you to contact us. Or you can always share our information to consumers who you feel might need some additional help, especially surrounding community health choices. We'd be glad to assist them. All of our information can be found on our website. And if you have any requests for outreach or information to be delivered locally in your community, we would certainly welcome the opportunity to do that. Please feel free to contact us.
This is Kathy, just again chiming in to thank you for your time, and again, we love to hear from you and your experiences. And CARI, as hopefully you all know, I know our senior Medicare wonderful volunteers know all about CARI, but if this is your first connection to CARI, we do advocacy on all kinds of any kind of issue related to older adults and their caregivers. So don't hesitate to contact us. And thank you very much.